Okay, can you please join me in welcoming Dr. Christine Cassidy, Jacqueline Pediatric, and Amanda Higgins, who's here in person. The others, I think, are joining us online, and we're going to hand it over to them for their presentation. Amanda?
Wonderful. Thank you so much. I'll just let Jackie get the slides up there.
There you go. Did that
Perfect.
work?
Yes, I can see them.
Fantastic.
Okay, wonderful. So hello, everyone. My name is Amanda Higgins, and I am a patient partner turned researcher for this study. And I am joined by two colleagues back in Halifax, Dr. Christine Cassidy and Jacqueline Pediatric. The project was a collaboration of the Transitions of Care Committee at the IWK and the Maritime Spore Support Unit. We explored the transition from pediatric to adult care, and we're presenting the qualitative part of that study today. We're hoping to share our findings from our qualitative study on the barriers and enablers of transition and to talk about our integrated knowledge translation approach, bringing together patient partners, decision makers, and researchers. We want to acknowledge the support of a mentored grant through IWK, as well as the support and that the fact that this project was made a priority by the MSSU.
And I just realized as well that I signed in with Amanda's information. So I'm actually Jackie Pediatric. I apologize for that. And I would also want to acknowledge that Christine and I are in Mi'kma'ki, which is the ancestral and unceded territory of the Mi'kmaq people. And that land we all share. We are all treaty people based on the treaties of peace and friendship. And so as we begin today and to talk a little bit about transition, we wanted to talk to you a little bit about what transition is for those of you who may be new to that. So when we think about that transition from pediatric to adult healthcare, we think of it as that purposeful and planned movement of youth with chronic health conditions from pediatric care to adult care. And so we have this general understanding that it begins from the time someone enters into that pediatric healthcare system and all the way to the time that they land into adult care, that they feel like they can navigate it, that they feel confident and valued in that adult healthcare system. And that ideal transition is hopefully supported by individualized planning for every young person and for their family, a coordinated transfer of care, and again, that secure attachment to adult services. And so when we talk about transition, we're referring to that whole process from entering into pediatrics to the time that folks are securely attached in adult healthcare. And transfer then is just that point in time when youth are referred from pediatric care to adult healthcare system, but knowing that youth are still building their skills before and after that one transfer point. And so in our sort of key messages from our research, we came up with sort of three particular pieces and then a fourth. One that we're all learning throughout transition. So we always sort of assume that we've got these youth who are learning these new healthcare skills, but really all of the folks involved are learning through that process. So youth, caregivers, as well as healthcare providers, we're all learning throughout that transition process. And everyone's sort of trying to find this balance of providing independence and support to youth. And we need to recognize and address it. It's not just the skills or the role changes that we're trying to balance with that shift, but also the emotions for youth, the emotions for their caregivers, for their parents, and for healthcare providers. So in order for us to support those youth and families to build the skills they need, we need to acknowledge all that, the emotion and the skills that are required. But we also need to acknowledge the values that are attached to that independence and that language of independence. So in our research and in much of the transition literature, independence comes up quite a bit. But we acknowledge that is that language is sort of steeped in some values of capacity, of ability, of colonialism. And when we look at transition and we look at that definition of independence, that context and that value is not going to match for everyone. So in our research, we tend to use that language of independence because that's what we heard from our participants, but that's likely because of the limits of our sample and not a full experience of transition. And so when you hear independence come up through our research, we just ask you to sort of hold that gently and to recognize the value that's attached to that too. And then of course, like in much of healthcare, transition sort of brings up opportunities for communication and coordination. And so you'll hear that as well throughout the research. And finally, transition is really an exercise in trust building, where the end goal is that secure attachment into adult healthcare. And we know a patient trusting their healthcare provider is a key component of transition. And so those are the 4 things that you'll hear sort of come up in our research. And what we sort of thought about in terms of what comes out as important themes in the research. And then I will pass back to Amanda just to talk a little bit about more why we felt this research was important for us as a committee.
So first, as a patient perspective, there is a missing piece when it comes to transitioning from pediatric to adult healthcare. And sometimes as a youth, it feels like you're looking at a puzzle. There's one piece missing, but there's absolutely nothing left on the table. There's nothing left to fill that gap. And this research really helped conversations begin around how we can look to start to find that piece. Where is that piece? How can we find something to fill this gap? And then from a transition of care perspective, so the Transition of Care Committee at the IWK brilliantly is led by Jackie and brings together patients, caregivers, healthcare providers, and community partners. And so what we heard from them was really that the importance is knowing that transfer is happening, that it is a thing and it's going to be something that the youth and caregivers are going to encounter in their healthcare journey. And this research really reinforced the importance of the key message strategy that we have about transition, that it is a thing and we need to be aware and focused on it. So transition processes have developed in different ways and in different health systems. Currently, there's very little done to standardize transitions of care, and that can result in poor health outcomes for youth. The processes may not have been developed in a systematic way or evaluated, so it's important to understand the local context and barriers and enablers to care in order to support and improve the transition processes. Different care teams and clinicians at the IWK, Nova Scotia Health, and elsewhere have researched and evaluated transition in different ways within their own teams, but this work with the MSSU allows us to look at transition across various teams. So the research project is an MSSU priority project, the MSSU being the Maritime Strategy for Patient-Oriented Research Support Unit. And as the name implies, MSSU collaborates with IWK Health, the pediatric hospital in Nova Scotia that serves the Maritimes, Nova Scotia Health, and the Department of Health and Wellness to support health research in Nova Scotia and across the Maritimes. Priority topics were selected at a bridge event, and research questions were refined at a knowledge exchange event with key stakeholders, and transition from pediatric to adult healthcare, what became a priority project supported by the MSSU. And their support has really helped move this project forward in ways that we could never have done as a transition of care committee on our own. The objectives of the study were to explore the practices and experiences of youth, caregivers, and healthcare providers when it concerns the transitions to adult care. We used the COM-B, a behavior change framework that looks at motivation, capability, and opportunity. And this helped us identify the barriers and facilitators to the transition of youth from pediatric to adult healthcare. So integrated knowledge translation was a critical part of this project. The Transitions of Care Committee were involved in almost every part of the research project, and this created a richer result and helps to ensure the findings will be used to enhance clinical care. We reviewed the research questions for the focus group. We respectfully tore them apart just to make sure that they would be appropriate for participants, to ensure that we got the information that we wanted and that transition would essentially be looked at and we could use it as a committee. We helped to analyze the findings, and this discussion provided opportunities for youth like me on the committee to see how important it was to learn self-advocacy skills, and allowed clinicians to appreciate the important role that they have in their own approach to transition and the language and metaphors that they use to discuss transitions. In these ways, knowledge translation approach had unanticipated impacts, even within the research partnerships. And now Christine will take us through some of the theoretical frameworks that really guided this project.
Thanks, Amanda. So as Amanda mentioned, we used the COMBI model of behavior to guide this work. And COMBI is part of the behavior change wheel. And that's a framework that's been used extensively in health research to guide the design of different types of interventions. And it's based on this COMBI model, which suggests that for an individual or a group of individuals' behavior to change, there has to be some sort of change in either their capability, their opportunity, or their motivation. So the knowledge and skills, their social relationships, environmental context and resources, or things like goal setting, emotions, worry, concerns, those are all pieces of motivation. So we used this model to guide our analysis to identify what are those barriers and facilitators to supporting the transition from pediatric to adult care. So we conducted a qualitative descriptive study, and those that were included in the study were current and former youth patients, as well as healthcare providers. And we conducted 32 interviews, as well as 3 different focus groups with that semi-structured interview guide that was informed by the COMBI model of behavior. We had a working group of 4 people involved in the qualitative analysis, and that included researchers, youth partners, decision maker partners, as well as trainees, to conduct a directed content analysis where we looked at the transcripts and coded them using the COMBI model, and then conducted more of an inductive thematic analysis to generate themes related to the barriers and facilitators. So the next slide shows our participants. So we had 9 youth with experience in transitioning from pediatric to adult care, 8 caregivers or parents, as well as 26 healthcare providers. Of the healthcare providers on the right-hand side of this slide, you can see that 15 were adult or pediatric nurses or allied healthcare providers, and 10 were pediatric or adult or primary care physicians. The allied health providers included occupational therapists, dietitians, social workers, and psychologists. So I'm going to share with you some of our research findings from this work. Just want to highlight a couple limitations for you to keep in mind as you hear about the findings. So despite extensive recruitment, we actually started this study before COVID. It wasn't meant to be a COVID study, but of course it turned into one. And so we had some troubles with recruiting primary care providers and youth. So we had fewer that participate than planned, but the number of youth that did participate was adequate for our qualitative analysis. And we also struggled to identify and recruit youth from equity-seeking groups, and equity questions were not part of our qualitative data collection. And so we recognized this as we were moving through our data analysis and saw that it was a key piece missing in our findings was related to health equity. And so we recognized that that can be a next step to this work, and that would definitely further enhance the research in this area. So I'm going to start by sharing some main themes from the youth data. So the top main 3 themes related to this were health literacy to support the transition process, youth's readiness for independence, as well as health system coordination. So as part of the transition process, youth described developing their health literacy skills. So that was the knowledge and skills to find and understand and use their medical knowledge about their condition and information about the transition process. So youth described needing to learn these new skills. So for example, learning how to do injections and become more independent in managing their own care. Youth described the real pivotal role that their caregivers played as they incrementally prepared them for transition over time. So youth called this a soft launch when their parents or caregivers helped to over time prepare them. And it was really interesting. Youth were very motivated. They wanted to develop their independence. They wanted to become self-advocates as they transitioned to adult care. Youth were describing being in multiple transitions at once. So yes, one was, of course, the transition from pediatric to adult care, but they also talked about this transition happening with their caregivers and going from being more independent and taking on that self-advocacy role. At the system level, youth described having an approachable adult care provider where they had an opportunity to meet with that provider, perhaps at a transition clinic or a transfer meeting where both their adult provider and pediatric provider were there with them. And this was seen as a facilitator for a positive transition. Youth also described their relationship with their pediatric provider and how that could either be a barrier or a facilitator to the transition, depending on the approach that the provider used. So when pediatric providers were negative about the adult care system, it really created fear and anxiety among youth. Whereas when pediatric providers were positive and treated this as part of just the continuum of care and supported youth to connect to the adult care system, that was seen as much more of a facilitator. And youth really described what a successful transition looked like if it was seamless, a fluid process that involved those positive relationships with both their pediatric and adult care providers. So this quote here just really recognizes the importance of making that connection with different care providers. And Amanda's just going to share a few reflections on those findings.
And so we know that the more we talk about transition, the better. Not every youth is going to go through a transition from pediatric to adult care, and there's certain transitions that as an adolescent we know are happening. We know that we're going to move from middle school to high school. We know at a certain point we could get our driver's license. We're going to decide our path for what our life looks like post-secondary. But when transition isn't brought up in a healthcare setting, in a way we're almost blindsided by it, and that's not helpful to anyone, healthcare provider, caregiver, youth included. The readiness checklist works, and this is a checklist that's used in clinic. It's either brought up by the pediatric healthcare provider or by a youth and their caregiver. And it's a checklist that has many self-management behaviors that aids the transition process. So this could be, I know all the names of my medications. If I get sick, I know where to go for help. Or I spend time alone with my healthcare provider during each appointment. And this guides, the family as they look to build those self-management skills with their youth. If you're interested in learning more or accessing a copy, I can help you with that after the presentation. And not only does this help start the conversation that we know is going to happen, but again, it helps with that building of those skills. And communication with everyone helps. Speak to all the healthcare practitioners on the youth's team if that's applicable. And speak with the youth and then again to their caregivers. Sometimes that can be done separately. Sometimes it's questions directed to the youth. We run a program in Halifax called You're in Charge. And it's a program that brings youth and their caregiver together, and we help them with goal setting and building some of these self-management skills. And in the last session we ran, one of the youth's biggest areas of growth that they identified themselves was to ask questions to their healthcare providers. They wanted direction on how to do this. How do I start? I'm intimidated. I'm nervous. And so the advice that was given was to start asking your healthcare provider about their favorite color, ask them what they did on the weekend. And soon those questions turn into questions about side effects of their medication or symptoms or complications of their diagnosis. And now we'll move into the caregiver findings.
Thanks, Amanda. So the main themes for the caregiver results were related to playing a supporting role in helping youth to develop that health literacy. Also, caregivers experiencing a transition of their own that's happening in parallel with their youth, as well as health system coordination. So to start off, from an early age, caregivers are providing support and teaching to prepare youth for that transition to adult care. They also play a really important role in the transition process by being the expert on their child's health history. As youth get older, caregivers really describe trying to find this balance between how do I encourage independence, but I also know that I need to be giving support. So as youth are gaining independence, caregivers were transitioning in parallel to a much less involved role. And so with this transition, caregivers sometimes worried about their child self-advocating and navigating this new adult system. When caregivers had strong relationships with healthcare providers, this helped to decrease that worry and build more of a positive outlook on their transition experience. And caregivers also noted the really important role that allied health providers play to support that transition process. Another piece of this is caregivers recognizing that when youth came to different life milestones, such as going away perhaps to post-secondary school, this acted as a prompt for caregivers to refocus on the transition process. And of course, lots of barriers and facilitators related to health system coordination. Caregivers described many differences between the two systems, such as a focus on issues as opposed to more of a team-based approach to care in pediatrics. And so these factors really were presented as barriers to the transition process. Caregivers also recognized that, and they found that the way communication happened with the healthcare system to be either a facilitator or a barrier. So conversations seem to be part of that, conversations around transitions seem to be part of that standard part of pediatric care, and that was seen as really helpful. So were any types of transition clinic meetings where adult care providers and pediatric care providers were both present. It was neat to hear about the different forms of communication that caregivers recognized as helpful to support that system coordination. So phone calls, using Zoom, email, and text messages were all seen as facilitators to engaging youth and having youth supported through that transition process. So caregivers hope that this type of communication, although it may have been introduced because of the pandemic, would continue in the future. This next slide just highlights some of the challenges that caregivers go through with supporting that independence, but also trying to hang on to that navigator role. And again, Amanda is just going to offer a few reflections on those caregiver findings.
And so highlighting the importance of language around transition is key. It really does matter. Some of the first things that a youth could hear when transition is brought up is that it's scary over there. It's different. They're not going to do X, Y, Z with you. And that really, it's frightening before we've even begun almost the process of our transition or our transfer. We've heard it compared to when high school teachers are ready to graduate their students to go to university, and it's so hard. They're not going to baby you. You better buck up, those kinds of things. It really does make a difference about how youth land and stick in the adult healthcare system, and that affects their health outcomes later on in life. We know that from other research that trust in the adult healthcare provider is a key factor in a successful transition. And so building up that trust starts in pediatrics, and we heard that through our findings. And again, the balance that Christine mentioned is a challenging piece for families to find. It's hard to strike a balance of support and independence from a caregiver's perspective, and it's going to take them time. The concern and worry about transition really came through in the caregiver findings, but as we mentioned, not so much in the youth findings. They may be really excited, they may be ready for this independence, and so allowing them to take that on and juggling each case independently, because they're each going to be different. And lastly, we'll look at the caregiver findings, or the healthcare provider findings, sorry.
Thanks, Amanda. So the healthcare providers that participated in our study described some of the unique competencies that they needed in order to support youth during that transition process. So these were things like having an in-depth understanding of how to work with youth in that emerging adulthood stage, motivational interviewing, how to assess readiness, and having some knowledge about different change theories. Most providers described learning these skills really through on-the-job learning, as opposed to an actual formal training or learning program related to transitions. Some of the providers used the readiness checklist that Amanda mentioned earlier with youth. And when they did use that, they found it quite valuable, but many providers were unaware of this type of tool. Healthcare providers really played a key navigator role, and they facilitated and helped coordinate the transition process. So this would involve things like preparing youth for transition, attending transfer meetings with both the adult and pediatric providers, and being a key individual to educate youth on self-management techniques. Providers described really using a case-by-case approach to support youth and support this transition based on what the youth's needs were. So youth with maybe more complex needs may require more support, while others may be able to develop those skills to transition more quickly and need less support. The healthcare providers also discussed needing to support the caregivers to shift their care responsibilities onto the youth. And so a key part of this was developing a trusting relationship with caregivers so that they would be able to trust their child, that their child was in good hands. And so when providers used more of a person-first, non-judgmental language, this was really seen as a facilitator to building those relationships. And providers, they spoke about their motivation. They were motivated to ensure that youth were securely attached in the adult care system and not a risk to being lost to follow-up. And lastly, again, this health system coordination theme came up in the healthcare provider interviews as well. And so many different barriers and facilitators at the system level that impacted transition of care. So having a culture of collaboration and working in multidisciplinary teams with team members that had all sorts of different skill sets were seen as facilitators. Providers noted that if there was a lack of connection to primary care providers who were often not engaged in the transition process, this was seen as a critical barrier. System coordination related to follow-up was identified by many participants and identified as a concern, as some youth don't necessarily show up to their first appointments when they move into the adult care system. And so having transfer clinics or emailing or phoning youth who miss appointments and having more of a flexible policy about missed appointments were seen as facilitators to preventing that loss to follow up. And providers identified the importance of having infrastructure and resources on the transition process. So in Halifax, we have quite close proximity between the pediatric health center and the main health center of adult care in Nova Scotia. And so if you lived around that area, that was seen as a real facilitator to the transition process. But for those of youth that lived outside of the city, this was seen as a real barrier to care. Providers discussed virtual care as a way to help mitigate this barrier, but again, this was only possible for youth with access to technology. And lastly, participants described a range of other resources and communication tools that would be helpful to support that transition process in order to support youth to move successfully and securely attach in the adult care system. So this quote here just speaks to all the different pieces of coordinating from a healthcare provider perspective. So because we had conducted interviews and focus groups with 3 different groups, we then conducted a data triangulation analysis. So what that means is we looked at our different findings from across the 3 participant groups to identify where were some similarities and where were some differences between youth, caregivers, and providers. And so a key area was around this need for formal education and learning about health literacy. So for providers, formal learning opportunity weren't necessarily available, but they recognized it as being really beneficial. Each group described having responsibilities that changed over time during the course of the transition to adult care, and the need to shift that balance between independence and support depending on which group you were from. Caregivers and providers were much more concerned about greater independence, whereas the youth did not have that worry or concern. Both youth and providers really wanted a strong connection to the adult care system to be created. And all 3 groups identified that the healthcare system could improve communication practices in order to facilitate transitions in care. Over to you, Jackie.
So I wanted to talk a little bit about how we sort of created some integrated knowledge translation, and certainly our committee. So that committee that we call the Transition of Care Committee, that has young adults and youth who with experience in chronic health and with experience in transition, caregivers, healthcare providers, community partners. So that group has really looked at how we can integrate these findings into our work. And so one of those pieces is a transition framework. So we certainly see in other literature that importance of a structured process, and that when there is a structured process to transition, there are typically better health outcomes for youth. And we also were hearing from our Transition of Care Committee the importance of having consistency among our care teams. So all of our care teams within our system might be doing things slightly differently or a lot differently. And so how do we create something that helps to improve that consistency? So that's when we look to that research to try to help us build that consistency and approach. And as we were trying to figure out, there's many, many, many things that we could have put in terms of what are the important elements to put in this transition framework. And this research sort of helped us to really look at and focus on what are the important things in our area that we're hearing from youth and families and healthcare providers, and really focus on those areas as we built that transition framework. So we really looked at the importance of starting early and making sure, Amanda will talk about the fact that transition is a thing. And so we really reiterate in that framework the importance of that continual communication about transition, and also about that coordination of care. And so, you know, having small ways that we can create opportunities for communication and coordination are key in our transition framework. And then what's been exciting for us as a committee is then looking at, so how do we then implement this transition framework? And luckily we now have this relationship with Christine to be able to look at how can we best implement that framework. And so we're applying for some grant funding with our Translating Researcher into Care grant to try to see about how we can best implement that framework. Our Transition of Care Committee also has a bit of a planning tool. So we've got these 3 basic ideas that from this research, that we want to make sure that we're always building knowledge for everyone in the system, that we're helping to figure out that balance for youth and families and for healthcare providers as they move through this process, as they shift roles, and that we're supporting system coordination. So that planning tool is going to help us to sort of make sure as a committee, are we hitting those markers as we go through? And then on the other side, you'll see a little bit about our You're in Charge program. And that's really based on peer learning. Again, it's sort of reflected back in our research findings, and helping families to navigate that balance. So we bring youth and families together to talk about that experience together. And also we use the readiness checklist. So we heard very specifically that the healthcare providers aren't necessarily using the readiness checklist. So that was one way we could take the readiness checklist directly to youth and families to be able to use that. And then really excitingly, we wanted to be able to evaluate that. And this will come up a little bit later, but we were able to connect with Amanda as a committee member to try to work at informing that you're in charge evaluation as well. So those are some examples of how we're integrating those findings so far. But we also found that there was really some impacts for us. So for Amanda and Christine and I, in terms of this approach. And so Amanda, I was wondering if you wanted to speak first to your experience as a patient partner on the project.
Perfect. So as a patient partner, I'd never been involved with research before, and I've definitely grown as a researcher. Now working with Christine as a research assistant, you could really say it planted a bug in me, and now this might be my career path. This past summer, I was awarded an IWK grant, and so I built an evaluation on my own to evaluate the You're in Charge program, which is that self-management skill building program that we run. And I also want to add that my whole experience, I felt very valued and included, knowing that I may not have been the most important person to attend meetings. I was always kind of looked at as important. I felt important. They really tried to accommodate my schedule. Everyone at MSSU was great. And so it truly was an amazing experience to be a part of the study. And now, Jackie, as the decision maker, your takeaways?
First, I always get a kick out of being called a decision maker in all of this, but that's kind of fun. So our transition of care committee, one of the things that we are supposed to do is to evaluate the transition of care. And as a committee, we really, we knew that it was important, but we just didn't have the capacity and the knowledge of how to do that. And so this partnership with the Maritime Spore Support Unit was a really great opportunity for us to actually gain those skills. And then for me, I have been a social worker for a number of years. I've always been interested in doing research, but never was able to sort of figure out how to do it within my practice. And so I was able to get some supporting funding as well to build my own research capacity. And it's kind of interesting because now that I feel like I have some greater skills in that area, a little bit more knowledge, it's been able to translate into some other opportunities as well. And most importantly, I think similar to Amanda, that experience, that feeling as though my clinical knowledge really was integrated into the research as well, and hopefully had a good balance. So for that integrated knowledge translation, I think is not just around how we get our findings out, but also about the impact that it's had for me as a healthcare provider.
Great, and I'll speak to this from a researcher perspective. So I'm a registered nurse, and I started my faculty position as an assistant professor in the fall of 2019. And I was not a transitions in care researcher by any means. I had been doing a lot of work with the IWK and was really interested in how to use these types of methods to assess barriers and facilitators and design interventions, but had not met or even heard of Jackie, to be honest, or the Transitions of Care Committee for that matter. And so I was approached by the MSSU to see if I was interested in joining this team as the researcher. And this could not have come at a more perfect time for me as an early career researcher. I was at the very beginning stages of developing my research program, and it was such a great opportunity to have support from the research staff and MSSU staff to act as my own little research team to help facilitate getting meetings together, REB, Research Ethics Board applications, managing documents, managing data, all those pieces that come with more time of being a researcher, and the skills in that. I was able to have that support from MSSU, so that was really valuable. What also came from this IKT approach of working with Jackie and Amanda and the Transitions of Care Committee is that I was able to see direct application of research findings in real time. I promise I couldn't even keep up with the speed in which they were asking for findings so that they could use it for their planning tool, for their transition framework. And that is really rare in research. Oftentimes we are kind of, as researchers, over in our academic institutions doing research. We write up a paper, we publish it, no one ever hears about it, no one cares about our findings. And that's because we aren't normally doing research in such close partnerships. And so it was really impactful to see that direct application of the findings. And as a result of this work, I feel like there's just endless research questions that are coming from it. Amanda was successful with that IWK summer studentship in developing an evaluation framework for the You're in Charge program. We have a research in medicine, so a medical student at Dalhousie who is building on this work and going to conduct a scoping review, looking at training programs for healthcare providers related to transitions in care. And those are just two examples of, Jackie mentioned the new grant to assess the implementation of the transition framework. And there's even more on little Post-it notes all over the place, all over my desk of different questions we can ask based on this work. So that's really exciting from a researcher perspective.
And so some more lessons learned from our approach. There was huge capacity building within the transition of care committee. We learned what the COM-B model was. We had no idea what it was when Christine brought it to us. And now some of us are looking at how we can use that in our own committee's work. And we've also learned about trustworthiness within our qualitative data and how bringing the data back to the Transition of Care Committee throughout the process really built the trustworthiness of it through member checking. Our study, as Christine mentioned, began before the pandemic, but quickly became a COVID study, turning all our meetings into virtual ones. And that allowed us to bring in people from across Nova Scotia into our work. And the patient support received from the MSSU was amazing. As I've mentioned, it was my first experience as a patient partner. I was really unaware of what to expect, but the MSSU made sure that there was a place monthly for me to connect with other patient partners in a virtual coffee chat. They supported me through email check-ins. And so being supported from all angles really allowed me to speak up in meetings and have my voice heard.
And I think on our transition of care committee, some of those lessons learned, of course, to build from what Amanda's talking about, is that our committee is really built on relationship building. That's sort of the core of how we work together so that we can have open and honest conversations. And I think that allowed us, when we did some member checking, when we looked at our data, we were able to be truthful and honest about what we thought, what we saw in the data. Amanda will talk about those initial research questions. The youth on our committee were able to have the confidence to say, no, this isn't going to work. Like, let's do this differently, which I think was based on the fact that we already had this sort of strong basis of relationship together, and that we were able to create, again, these findings that were tailored, that we could use right away, which was incredibly helpful to us.
And from a patient-oriented research perspective, something that came up a lot was this, what's often seen as a dichotomy of, okay, we need to be doing really rigorous research, but it also has to be really relevant to whoever needs to use the research findings. And so I really, from this work, have started to think a little bit differently about this. And is research really rigorous if it's not relevant? And really that should come first, and make sure that we're asking relevant research questions that are going to be impactful and the findings are going to be used. And that's what patient-oriented research is all about. And then ensuring that it has the rigorous methods to go alongside that. Another piece that really comes up when we think about and have been doing patient-oriented research is the importance of relationship building. So relationship building within that transition of care committee, within our kind of MSSU research team, and what a key role MSSU kind of almost as a relationship broker played in making sure that relationship was maintained, that we were continuing to have meetings and check-ins. I will be honest with you, I feel like if I was just me trying to manage all of this as an early career researcher, it would have been really easy for the maintaining the relationship within our group to probably fall off my plate, or I would be trying to do it off the side of my desk. And instead, by having someone in that role to help facilitate the relationships, it made sure that the patient-oriented research piece was at the forefront of all of our work.
And so one youth who participated in our focus groups gave us this wonderful analogy that I'm sure we're all familiar with, of the obsessive nature we can take when we order something online and we track it until it's safely at our doorstep. But the quote is, "But the second part of what would make a good transition, I look at it as if somebody was receiving a package. They check to see if the package was landed, and the people receiving it had received their package, and it was all good. It was landed. It was in the right hands, and everything was okay." And we love to think that wouldn't that be great, is if healthcare providers knew that every youth that they transferred to the adult healthcare system or the youth received on the adult side were landed. There was a confirmation their shipment of support and trust and safety that we all know is craved in times of change and transition. And so that concludes our presentation today, and we hope that we shared some insight through our findings, but more importantly, our approach. Thank you so much.
Do you have time to take a question or two if we have some?
Absolutely, yeah.
Are there questions for the presenters? Oh, question. She's running up to the mic. She's almost there. There you go.
Hi, my name is Emma Eaton. I work for the government as the manager for both the child youth counseling service as well as an adult outpatient counseling service, so we do have transfers in between the two. So I found your presentation really interesting. I just had a couple of questions and one thank you. I'll front load with the thank you. The rigor versus relevance piece takeaway, I found that very validating. We're doing our own research with the SPORE unit, and I felt a little bit like torn in some of our practices. So I've this morning I was like, yes, I'm just going to make it useful. And then I came here and you said that, and I was like, yes, I was right. So thank you for that. Very validating today. And then I just wanted to ask if I don't want you to disclose any confidential information, but were any of the youth in your studies going in or out of mental health services? And would you think that anything would be particularly different? I thought that it was quite relevant, but just ask.
Yeah, so I'm so glad it was validating for you today. And so in our qualitative study, we looked at three major diagnosed groups. And so we looked at juvenile arthritis, diabetes, and
IBD, inflammatory bowel disease.
There we go. So those were the three disease groups we looked at. So all the youth participants came out of those clinics.
Thank you.
Thank you.
And the other piece I would just note, though, too, within our transition of care committee, and when we did that member checking, we would have youth who have experience in both what we would call the medical, the physical healthcare system, and also the mental health care system. And so there was nothing particular that they would have outlined when we did that sort of member checking piece. Certainly some important lessons on both sides, but we do certainly would have had folks who would have some experience in the mental health transfer of care as well.
Any other questions, comments? Okay, let's give a